My name is Dr. Lauren Edwards, and I was born and raised in Omaha, Nebraska. I did my undergraduate training at University of Nebraska-Lincoln and then came to Omaha for my medical degree. And then I did my psychiatry residency in Ann Arbor, Michigan at the University of Michigan before coming back here to work. So I got into medicine because I really love working with and learning about people. In particular, I love psychiatry because it allows us the time to sit and talk, and I really get a chance to understand who you are and all the things that contribute to that. So, your identity, family, community, the neuroscience and physiology. I love learning about all of these things, and my patients teach me every day. They teach me about who they are, and I learn more about who I am and what it is to be human. So it's incredibly rewarding. I also really love the relationships that I get to form with my patients. I take a lot of responsibility for the trust that people put in me, and it's something that's very valuable to me. As a general psychiatrist, I can treat anything along the spectrum of mental illness to mental health. In particular, I have special training and interest in treating anxiety disorders. So that would include OCD, generalized anxiety disorder, panic, social anxiety, and phobic disorders. Everyone experiences anxiety every day. At times it can be very normal and also adaptive. Anxiety can be helpful to all of us, but somewhere along the lifespan, it can get to the point where it gets in the way of you meeting your goals. It can become impairing. And what I love with my job is helping patients come to conquer their fears and experience freedom from anxiety. It's something that drives me to work harder every day. Typically, when I first meet with a patient, we'll sit together for an hour. I'll have a chance to hear about you, and the first thing I really want to understand are the concerns that brought you to making that appointment today, and then also, what your goals and what your values are, so we can be on the same page right from the very beginning. I really believe in the value of both psychotherapy and medication, and finding a combination that's most effective for you. For mental health, there's really no one, correct path to success. And while that can make it tricky sometimes, it also allows us to have a whole array of tools at our disposal. And I think that you need to feel comfortable with your plan, and we need to find a solution that is individualized and feels true to you. But I want to be there as a guide to give you good information, realistic expectations, and increase your chances for success.